Hi, today we are here with Dr. Naim, one of the best OBGYN in LA, to talk about one of the issues that many women face. Hi Dr. Naim, good to see you. Thank you for coming and being with us today. Please give us some information about the causes of irregular bleeding.
Hello everyone, hello Zina, it's good to see you again. Irregular vaginal bleeding or dysfunctional uterine bleeding is a very common problem we see on a regular basis. A lot of times patients are concerned that maybe something's going on or something bad is happening to their body. A lot of times this is caused by either a physiological or anatomical problem. Physiological meaning that it could be hormonal. When the patient comes with this situation, we do a hormonal test, we check the thyroid test. Low or high thyroid can cause irregular bleeding. We might check FSH, sometimes being perimenopause might cause this. We check sometimes called a hormone called prolactin, is a hormone that's secreted from the brain, and high prolactin can cause less period or sometimes no period. We might do some other hormone tests on these patients. Obviously, if any of these issues comes abnormal, then we treat those. The other side could be anatomical problems, things such as a fibroid can cause irregular bleeding, which is a benign tumor. It could be something called a polyp, which is like extra growth of meaty tissue of inside the uterus. The polyp can cause irregular bleeding, or occasionally it could be cancerous cell or precancerous cells. I should tell our viewer that it's almost never you see precancerous in somebody less than 40. If somebody comes to our is less than 40 years old, we rarely do any workup for cancerous cell or precancerous. But if somebody is over 40 and has abnormal bleeding, then I do recommend a biopsy to make sure there is no such a precancerous cell or cancer cells involved. These are just to go over the major basic reasons of irregular bleedings.
What are the treatment options?
There are many options available to treat this situation. Obviously, after we make sure there is no hormonal issues going on as far as the thyroid or anything else, we do ultrasound to rule out any tumor or anything like that. A lot of time we study patients on some kind of birth control method that helps them. The pills usually helps them to have regular period. Before going further, I want to tell you that sometimes the pills can actually cause irregular bleeding. So if a patient is on some kind of birth control pill, I might change this dosage to regulate them more. But if somebody is not on any pills, things like pills, IUD can help them, ring can help them, patch can help them. Any kind of birth control can usually adjust their cycle. If we think about something anatomical, I might do something called a hysteroscopy, when I put a camera inside the uterus and look for the polyps and remove them, or maybe I do that to remove the fibroids. Or again, if somebody is concerned about being abnormal cells, I might do a biopsy before going any further. But in general, any kind of birth control method does help this situation, regardless of the cause, as long as it's not cancer or precancerous cells.
Thank you so much, Doctor. You are very, very informative. Hope to see you soon again to discuss another subject. Thank you.